Let's get you up to date with the latest headlines in the COVID-19 outbreak. Just out this morning, U.S. unemployment claims soared to 3.3 million. In the wake of the COVID-19 outbreak, that is more than 4 times the record that was set back in 1982. Think of all those people, 3.3 million, and that's just the beginning. A massive economic stimulus package is one step closer to President Donald Trump's desk. $2 trillion package goes to the House. The Senate did approve it late last night. It includes billions of dollars in help for businesses and a cash payment of up to $1,200 for most Americans. Stocks, well, the markets seem to like it. They opened 2% higher. We're almost 3% higher now after the Senate passed relief bill. Even though that burst of unemployment applications was a huge number, it did fall a little bit short of the worst forecast on this. You see the Dow up almost 600 points, 2.8%. Governor Walz has issued a stay-at-home order for Minnesotans. Enforcement begins tomorrow at midnight, will run all the way through April 10th. What about restaurants? They stay closed to dine-in customers until May 1st. Carry-out and delivery still happening. Schools will be online only until May 4th. So bottom line, if you don't need to leave your home, you shouldn't. You can still go outside for a walk around the neighborhood, get your exercise. Trying to keep social distancing. Don't crowd those parks. You can still go get groceries, including alcohol. That curbside pickup and delivery from restaurants, as I mentioned, still allowed. If you have an emergency medical need or need to go to the dentist in an emergency, that's still available. Gas stations still open. Banks, too. You should only go to work, though, if you're providing an essential service for teachers and parents at distance learning. Starts on Monday and will continue for at least the next 5 weeks.
This is just the next step of what we will need to do during these unprecedented times to stay ahead of this.
If it makes us safer for everybody, we support it. Schools being closed, though, is going to be a challenge. So for that, we're just fortunate that the liquor stores have stayed open.
We all deal with things in different ways, right? Governor Walz said he would like to see people voluntarily comply with this, but they could treat this like a misdemeanor. You could get up to a $1,000 fine and or 90 days in jail. Now, not everyone is sure that a stay-at-home order is the best decision. Republican Senate Majority Leader Paul Gazelka says he shares the governor's concerns about safety and well-being, but he said he has grave concerns about this statewide order and the consequences for the families of Minnesota when their jobs and businesses that provide their livelihood are lost.
Now, Governor Walz says that the number of ICU beds, they were a big part of his decision to issue that stay-at-home order. Right now, the state has a total of 235 ICU beds, and the governor says if we hadn't done anything, any social distancing, we would have filled all of those beds in right about 6 weeks. But by practicing social distancing, by having people stay at home, he says we should be able to push that out until 11 weeks. The governor also said that more ICU beds might be available if they are needed. Hennepin Healthcare is prepared to add 38 ICU beds if necessary. The governor said that they could look beyond hospitals for places to treat patients with COVID-19, like arenas or hotels or public buildings that could perhaps be converted into hospitals. But one doctor told us it's way too early to start thinking about that, and that right now their focus really has to be on what we can do inside those hospitals first.
We're looking at medical surgical beds that could be enhanced so that we could take care of some more critically ill patients there. We're looking at other spaces within the hospital walls.
Officials said that making sure that the hospitals are properly staffed and they have enough personal protective equipment, have enough ventilators, are their next priorities.
Wisconsin has now reported its 6th death from COVID-19. State has 585 known cases right now, while Minnesota has 287, almost half that. The Minnesota Department of Health says 122 of those patients have recovered enough that they don't need to be isolated anymore. 26 people are in the hospital and 12 people are in the ICU. A Minnesota woman says she was one of the first in the state to test positive for COVID-19.
And it felt like my skin was on fire, like someone was stabbing the marrow of my bones.
29-year-old Jillian Nadimi lives in St. Paul. Her doctors think she caught the virus when she went to visit New York City on March 6th, but it wasn't clear to her, nor was it clear to her doctor right away.
After talking to the doctor about my symptoms, he was positive that I did not have COVID-19. He actually came back into the room and was not wearing a hazmat suit.
Test results eventually confirmed she was Minnesota's 22nd case. Said after a few days she developed a dry cough and shortness of breath. Nadimi says she is feeling better now, but she hopes her experience especially convinces young people of their vulnerability to this and the importance of staying at home.
On this day that we're hearing about millions of unemployment claims, right here locally, thousands of Lifetime Fitness employees could soon be furloughed. The CEO told Fox News that without a specific date to return to work, he may have to lay off 90% of his workforce. That would affect about 36,000 people. Most, if not all, of the gyms across the country are shut down because of COVID-19. Now, Lifetime is a Minnesota-based company. It says it's paying its workers through tomorrow. The CEO says that he has also cut pay to himself and the entire executive team to zero. St. Paul city leaders are considering emergency relief for low-income families and small businesses.
In these moments where it feels like a long, uncertain road ahead, we see all around us our St. Paul spirit of unity.
Families who qualify would get $2,000 in direct assistance. Businesses could get grants for rent, employee health insurance, and payments to suppliers. The city council will vote on that fund next week.